Hi everybody, we're back here from Evanston, Wyoming. It's a snowy day. We're ready for the snow to go away, but it's been an eventful day. Anyway, we're going to do this though, and we're going to have a good time learning how to do an abdomen or a KUB, which for your information, hint, hint, is kidney, ureter, bladder. That's what KUB stands for, okay? So the projections we're going to look at today is a supine or laying down KUB and an upright, okay? SID, source to image distance, is 40 inches. Central array, for the KUB, it's centered at the iliac crest, where the upright abdomen is actually centered 2 inches above the iliac crest. And we'll show you that and why we do that, okay? So collimation-wise, for the KUB, we need to include the pubic symphysis inferiorly, and superiorly, we need to include the upper poles of both kidneys. I know sometimes it's hard to pick out kidneys, but if you've got your collimator open the right distance, you're not going to have a problem because you're automatically going to pick those up. The upright is actually, so superior, we just talked about that. Inferior of the KUB, we need to get the pubic symphysis, okay? Laterally, we need to get the lateral abdominal walls. Easy peasy. Technique, we're going to do a standard 70 kVp on most patients. The mass is going to vary on KUBs and abdomens quite a bit depending on the size of the patient. So for instance, Kate, I would probably shoot it at 30 mass. There are gentlemen that you get in here, and women, that are big. They've got a big belly, and we've got to get through that. So we can shoot up to 120 mass or even higher depending on the size of the patient. But average is going to be 20 to 40 mass, okay? Whereas kids will probably be the 10 mass. So 70 kVp at the variant of masses, okay? Let's see, tips. These all should be done on suspended breathing, okay? No breathing, we don't want any movement going on down there. It will blur the image, okay? There should be no rotation, and when we do a critique on this, I'll show you where you look at your obturator foramen. They should be the same size, okay? If one of them's bigger or skewed a little bit, that means that you're rotated. Let's see, we need to have proper penetration, proper density, and proper contrast. And that's where the mass comes in. Don't be afraid to double, quadruple your mass. Sometimes that's what you have to do to get through the body part that we're looking at. So, okay, that's an abdomen in a nutshell. Let's just go through the positioning real quick. Again, we've got Mikkel on the camera, and we've got Kate, our fearless leader, as our model, okay? So, always remember that we need to use our grid, okay? We talked about grids last week. Okay, anything over 4 inches, we need to use a grid because we're going to get lots of scatter radiation. That just helps clean it up. Okay, it gives us a sharper picture, right? Okay, now we need to make sure they don't have any buttons or zippers. If they have buttons or zippers, put them in a pair of shorts, or you can even cover them up with a sheet. Okay, just make sure that you don't have any artifacts there. So we're going to open our collimator to 17 inches long, okay? Unless you're doing a kid, you're always going to open that to 17 long. Always, always, always. That way you're going to be able to get the most bang for your buck, okay? And then on this machine, I will open it width-wise to 14, 15 inches, okay? Now remember that the central array comes down in a cone, right? So we're actually going to get more of what we see right here, okay? So if you're open to 14 or 15 inches, you're going to be fine, okay? So our central array is going to be on the midline of Kate. And have you scoot this way for a minute, just a little bit, okay? And we can see that by her belly button right there. Okay, we can't see her belly button, but it is there, I bet. Okay, so central array, midline. Okay, now our mid central array is going to be right at the top of the iliac crest, okay? And I need to move Kate down a little bit, I guess, terribly. Okay, there we go. Okay, so We got the iliac crest coming down like this. Here's the top of the crest. That is where our central ray is going to lay, okay? So midline and iliac crest. Now, we're going to use a right marker. Now, sometimes there's text that will actually put that on the body, which is okay. But I prefer to put it in any light up here, okay? That way that is going to show us that is the right-hand side of the body. So try to use your markers, okay? That way there's no question when that image comes up without a marker, okay? So we're centered, we're ready to go, we're collimated correctly. Open 17 this way, 14 this way, okay? And we are going to shoot our picture. Like I said, I would do 70 at 30 on Kate. Just make sure you're getting proper density. If your image comes up really light or underpenetrated, you're going to need to double or even quadruple your mass. Okay, your KVP is going to stay the same on these. We're just dealing with mass to get the number of X-ray photons that we need to get through that body part. Okay, so just remember to use your grid on these. And this is the Supine KUB. Okay. And when we come back, which will be like in a split second, I'm going to show you guys how to do an upright, okay? Yeah, I told you it'd be a split second. Voila, look at us. We're good. So this is the upright abdomen. The majority of the providers that I work with, they actually prefer an upright abdomen. Just, you know, for air fluid levels, it's much more descriptive. So most providers will do an upright. I say that, but for an upright, what we need to see is a little bit different than what it was with the KUB. KUB, it's very important that you get the pubic symphysis, but you're only going to go as high as the top of the kidneys, or the upper poles of the kidneys, okay? Now, an upright, we need to be able to see the diaphragm, okay, or the lung bases, costophrenic angles, we need to see those, okay? So, of course, you're going to see a little bit less down here. And I'll show you a trick if your provider wants to see the whole thing on an upright, okay? So here's just an upright. Stand your patient up there straight. Have them bring their legs about shoulder width apart, just so they're straight up and down, and we're not going to get any rotation this way, okay? So we know that our central ray is midline, right? And we're going to go 2 inches above the iliac crest. Okay, here's the top of Kate's crest. And sometimes it's hard to feel that on a patient, but sometimes you really got to poke in there to find that iliac crest. Kate's no problem. It's just right there. Okay, so here we got about 2 inches or 2 finger widths above the iliac crest. Okay, and the reason we do that again is so we can get the diaphragms and the costophrenic angles. We need to be able to see those. Sometimes we're looking for a perforated diaphragm or mesentery muscle. That's a good way for us to see that. If we cut the top of the diaphragm off, it's not considered a good X-ray. So just remember that on an upright, 2 inches above the iliac crest, so we can get the diaphragms. Okay, so we are going to put another marker here. We can see where that light is. We're going to stick that right there. Or up here in the light is fine too, but just make sure you're marking right or left. That way we know what side of the body it is, okay? All right, and we're gonna do this on suspended breathing. I would say, Kate, hold your breath, okay? You don't have to take in a deep breath or anything, just stop breathing for a split second, okay? And yeah, that's what we do. Okay, now artifacts, again, make sure they don't have a button or a zipper or anything in their pockets. This one, sometimes you have to have them take the bra off if they have an underwire. If they're wearing a sports bra, you're usually okay. So shielding for abdomens, it's hard to do, okay? We're just, on majority of patients, we're not going to be able to shield an abdomen shot, which is understandable, okay? What else do we need to talk about? I think that's pretty much it. Oh, I was going to show you, if your doc wants to have the pubic symphysis and the diaphragms on there, we're just going to shoot our KUB technique upright, right? So we're right at the crest, okay? And then we'll shoot that picture, okay? And then we're going to come up here, and we're actually going to do the upright technique, 2 inches above the crest. Okay, that way we're going to have one picture that has the diaphragm, one picture that has the pubic symphysis. It's okay to take 2 pictures, okay? And if that's what your provider wants, please do that, okay? But you may want to clarify with your docs which one they prefer, whether they want a supine KUB or an upright abdomen, all depending on what they're looking for, okay? Okay, well, thanks for coming by today. That was really nice of you. So, questions for the day. What does KUB stand for? KUB. Think about it. What does that stand for? Okay. And what is the breathing technique that we use for an abdomen? Okay. All right. You guys have a good day. We'll see you next time. Bye.